Hello, doctors. Welcome to this channel. My name is Dr. Nitin. And if you are a doctor or clinician from a clinic or a hospital setup, maybe this video will find you useful. Today we are going to talk about how you can stay away from any kind of political interference in your clinical practice. We as a doctor, we always and often come across some or other kind of interference from various political parties or maybe just individual with some political influence. So today we are going to talk about few ways how we can keep ourselves safe and we can stay away from those kind of political interference. And if you are new to this channel, I request you to subscribe to this channel because I always talk about various problems and how to solve those problems related to clinical practice. And I also talk about how you can grow your clinical practice with various business practices. And if you are new to this channel, please also share this video with your doctor friends so that they also know how they can safeguard themselves from any political interference. So without further delay, let's get started with today's session. So the very first thing that you can do is that you need to follow the ethical guidelines, because if you are not following ethical guidelines, you are more likely to get trapped by or threatened by these political peoples. So you have to familiarize yourself with various ethical guidelines provided by medical associations. It can be a national level medical association or maybe even your local level associations, because their support and their guidance is always needed. Then you can maintain a professional boundaries whenever you are dealing with patients or any kind of visitors. You have to avoid any political discussions with your patients or maybe even your colleagues during working hours. And I would suggest, if possible, avoid any political discussion itself. Because let me give you one example. When you are either supporting or you are opposing any political opinion, then obviously the next person is going to have some or other political affiliation or belief system. So if that belief system is making us any kind of contrast, uh, particularly in India, religion and politics are very strong emotional places where people get very attached to these beliefs, particularly related to religion and politics. So we have to avoid any kind of political discussions with our patients and even our colleagues or staff members. Then the very important and very critical thing is you need to focus on the your patient care, because when you are working for your patient and your patient is standing for you, that will be happening only when you are prioritizing patient well-being and you are providing all the possible good care for your patients. So you have to build that patient-centric approach in your practice from the root itself. Let it be your staff member, let it be your vendors, or any point of time in your clinical practice, that belief system has to be there that you are working for the patient and he is your God. Okay. So if you are maintaining that, just let me know how and what all practices you are doing to have that patient-centric approach in your clinical practice. Let me know in the comment section. Then you need to avoid any kind of political endorsement. I have seen various doctors inviting local politicians with the fear and with the thought process that because of those local political affiliation, I will get maybe more patients or I will get some kind of security from local politicians. But again, I will repeat the previous point again. When you are inviting somebody, he is having a particular set of political affiliation. And obviously, this is going to repel or create some opposition for you in the second set of political affiliations. So if so, you cannot make everybody happy, because when you are supporting somebody, you are indirectly opposing somebody else. So you have to balance that ratio, and you have to be careful and try to always refrain from like any political endorsements, uh, unless and until you have the intention to go into politics. But if you are planning to just stay in your clinical practice and you want to just serve your patients, I would request you to stay away from any kind of political affiliations. Then you have to be stay informed. You have to be updated about what's happening in your local politics, what's happening in national politics level or world politics level. That information or that knowledge is not going to harm you, but make sure that you don't kind of form some kind of opinions and get biased because of your personal preferences. Okay, you can discuss and debate within the doctor forums only, or the forums where it is very essential, but avoid any like discussions into any direct political forums. Then you have to keep separate your personal views from the political views. This is the safest thing. It's very natural that we are inclined towards some or other politicians, and we are opposing some or other politicians' thought process or the working pattern. That is very natural as a human being, but we have to learn how to keep those emotions under control and how we can keep those thoughts separately. Then you need to participate wisely in any political activities, as I mentioned, unless and until you have that plan to enter into politics or into any political activity, then it's fine. Otherwise, try to stay as far as possible from this kind of activities. Then you need to follow the legal compliance. This is not just from medical legal point of view, but from this kind of social attacks, attacks by political goons and patient relatives. If you want to like safeguard yourself from all these kind of bad things, you need to have that legal support system ready, and that will happen only when you are following all the compliances and you are making your decisions very legally and ethically. You are not taking any kind of bias on any aspects. Let it be the money aspect, let it be religion aspect, let it be political affiliation aspect. You have to keep separate your personal opinions and political opinions or any other personal beliefs separately from your core clinical practice, because when you are dealing with your patients, you are supposed to have the decisions based on the clinical grounds and not on any other considerations. So always have those kind of thing in place. And to learn more about this kind of legal compliances and ethical marketing practices, subscribe to this channel where I share various tips, ideas, and strategies how, without spending extra, you can follow these guidelines and how you can stay more compliant and grow your clinical practice. Then the extending the same point, you have to have a strong documentation and transparency policy so that you are maintaining all the records very clearly and transparently, and it is available for any kind of scrutiny either by the any legal agency, or let it be any political person or a political party. Okay. Then you have to have the skill for conflict resolution, because as they say, if you can solve those issues in time, you can avoid the bigger issues. So that is a one skill that you need to develop apart from your clinical practices, because if you are not having this skill, most likely you are going to end up in some or other conflict in some or other point of your clinical practice. So develop this kind of skills to know more about other skills to develop your clinical practice ethically. you can subscribe to this channel where I share various tips related to different skills related to clinical practice apart from the clinical knowledge and advancements. Then you can have your professional affiliations or associations with the medical associations which are working independently of any political pressures. We can always notice that there are various national level of medical associations, but they are uh, directly or indirectly associated with some or other political parties, and obviously it's leading to some or other kind of bias in uh, within those medical associations also. So it's not that like medical associations will always be in favor of medical fraternity. They are also doing some kind of political conduct in 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 some or other decisions related to uh, any regulations or rules which are coming or getting published by medical association. So you have to choose your medical association very wisely. If you want to know like how to choose this kind of medical associations, let me know in the comment sections. I want to see some comments. If you are asking for this, I'll definitely make a video on this. Then this is one of the critical and most powerful weapon that you can have in your clinical practice is about educating your patients. Because when you educate the patients, uh, we have already discussed that they when they get their health and wellness requirements and treatment options fulfilled, it is making them feel more empowered, and they are having more trust in you, and they are very less likely to invite any kind of political interference, because in most of the cases it has been seen that that patient conflict has been leading to some kind of political interference indirectly, and just to become a kind of social media hero or media or newspaper hero. These political people, they are ready to jump in into this kind of cases. So it's better you have that trust developed for your patients, because when your patient is trusting you so much, he is very less likely to involve or invite any political or even any kind of legal action against you. I hope these points are useful for you. And if you still have any questions related to this, I invite you to ask those questions in the comment section. And if you feel this video was very helpful for you, please give me a like. Your like gives me a motivation, and it gives me an indication that I'm actually helping the doctors to solve their problems. And if you have not subscribed to this channel yet, please do subscribe for getting upcoming tutorials notifications. And till then, thank you very much. Bye bye.